Welcome to today's press briefing. The two doctors on stage are Dr. Zhang Chuk-kwan, Head of Communicable Disease Branch from CHP, and also Dr. Gladys Guan, Chief Manager from Hospital Authority. The two doctors will give us information about the HA and also an update on number of cases. Dr. Guan. Good afternoon. We have 2,482 patients staying in hospitals. Of them, 265 are newly confirmed patients. For those who require isolation facilities, 1,217 of them in total. 6 cases newly reported in critical condition and 7 serious. For those who are hospitalized, 54 are in critical condition, 46 serious. 18 critical patients are receiving ICU treatment. We mentioned a critical case yesterday. It was a case of 2-year-old boy, and he is still in critical condition requiring intubation and ventilator because he has a high viral load leading to serious complications. This has nothing to do with the jab of vaccine he had. And I hope members of the public understand that vaccines are perfectly safe. Do take their children and get vaccinated as soon as possible to reduce the possibility of serious complications and even death. For those who have passed away, we have reported 9 new cases, 7 male and 2 female, aged between 66 and 92. Of the deceased, 7 have not completed their 3 doses of vaccination. In the past day, 355 patients have recovered. Of them, 316 have been discharged. Over to you, Dr. Zhang. Thank you. Good afternoon. As of yesterday, we had 5,541 positive cases, 1,586 positive through PCR, and 3,955 through RAT. We've got 146 imported cases, 121 of them positive through PCR and 25 for RAT. These 146 cases had 36 picked up at the airport, 33 at quarantine hotels or quarantine centers, 42 picked up on days 4 or 7 in community testing centers, and also 5 cases of samples collected beyond day 7. They came from 39 places. 4 places have imported more than 10 cases, 19 from the UK, 16 from Thailand, and 14 from the Philippines. The remaining 35 places have imported 10 or less cases to Hong Kong. Among the death cases, as said by Dr. Guan, we've got 9. So far in the 5th wave, we have got 9,764 death cases. For care homes, 2 care homes for the elderly and 2 for the disabled have reported a total of 5 positive cases affecting 5 residents. 39 residents are under quarantine. For schools, 526 schools have reported a total of 760 positive cases to us, affecting 647 students and 113 teaching staff members. They came from 105 KG or CCC, 221 primary school and 186 secondary school, and 13 special schools. In the past 7 days, schools that have reported 2 cases or more to us, 383 in total. Yesterday afternoon and this morning, we advised 10 schools to suspend some of their classes. One school is 李寶春聯合世界書院 has got 15 students confirmed. There are 240 students in this school. Some live in dormitories. There are 4 blocks, and they've all got cases. We've advised the school to suspend classes for 1 week. The whole school should suspend classes. And for the remaining 9 schools, 10 classes have to be suspended. For 1 school, 2 classes have to be suspended. Previously, there were 2 schools advised to suspend classes. Another class from Seoul Chikong Primary Secondary School 6A, 27 students in class, 4 confirmed cases. And then Sanyi Tinde Kindergarten in Chunwan, Iceland, PM and AM session has got 1 student confirmed respectively, and also 1 teacher who teaches both AM and afternoon session is also confirmed. So this class should be suspended for 1 week. For sublineage, for samples tested on the 17th, about 84% of them are positive to L452R, a little bit lower than the level yesterday. In the community, BA.4, 78%, close to 80%, not very much different from the situation yesterday. That's all from me. Question time. Please raise your hands and we'll pass you the microphone. Before you ask questions, please identify your media outlet. The lady on the right. Good afternoon. I'm from Cable TV. Regarding the 0+7 quarantine arrangement, what should be the bed vacancy occupancy rate before we can implement hotel-free quarantine arrangement? And other proposal is to do away with PCR tests before boarding. What should be the risk, and would you advise doing so? And allowing passengers to leave even before PCR result is available, is that risky? And what about BioNTech vaccines for infants? When then they be available in Hong Kong? Now, for designated hotels, because there will be no quarantine requirement for inbound travelers soon, so will there still be designated hotels? We understand that the epidemic has eased and there is room for us to adjust some of our social distancing and traveling measures. Details are being discussed and they will be announced when they are available. As regards infant formula for BioNTech under Cap 599K, the Secretary for Health can allow manufacturer or importer of vaccines to apply for permission to import vaccines into Hong Kong, and then the scientific committee will consider the efficacy, reliability, and safety of vaccines and give permission for such vaccines to be used. We've already received application from BioNTech when it comes to vaccines for young children, and then the case is now being considered by the Joint Committee and will make recommendation to the Secretary for Health. You talked about the impact on our healthcare system with the 0+7 quarantine arrangement. We will try to support government's policy. Now, when it comes to new admissions and number of new cases and bed occupancy, and also the percentage of serious cases, yes, things are improving. We're now discussing for non-essential services suspended previously, there may be room for some of them to be resumed. We are discussing that. We do not have any hard indicators whereby we will activate a certain stage, because this is a rather mobile decision. It depends on a basket of factors and also a data we have.
Next question, please. The lady at the back. Good afternoon. I'm from Hong Kong Economic Times. Now about the monkeypox vaccine. The vaccination program will begin in October. So for those who are interested, how can they prove themselves to belong to the high-risk groups? And how long must elapse after vaccination of COVID? And when will the infants' biotech vaccines be available? And how many vaccines, how many doses will be available in the first batch? Now for the 16-year-old deceased patient, was his death related to COVID? And what about the subvariant that the critical child has contracted. Now we have a press release concerning the monkeypox vaccination program. Please refer to the press release. So the Joint Scientific Committee has recommended for emergency cases, there should be a period of 8 weeks between vaccinations of COVID and monkeypox. That would be subject to the updated recommendation of the WHO. Concerning the 2-year-old boy, we don't know what his viral strain is yet. Now the 66-year-old male disease patient, he had a liver cirrhosis. He fainted and he was rushed to the A&ED. The CT value was higher than 30 on admission. He had a cardiac arrest and resuscitation did not succeed, and the case has been referred to the coroner's court. 7 out of the 9 deceased patients were not fully vaccinated. On admission to hospital, they were presented with fever symptoms as well as upper respiratory symptoms. The elderly patients had various chronic illnesses, and some passed away because of complications. Next question, please. Good afternoon. I'm from Hong Kong 01 about vaccination for children or infants. There are cases where infant children became ill or even critical after the first dose. What's the reason? Now, what about the ratio of vaccination for infants? Does the CHP have any advice or recommendations for parents to prepare their children for the upcoming vaccination? Now, my figures may not be the most updated. For children aged between 5 and 11 with no vaccination at all, the number is some 59,000. That's as at the 20th of September. For those between 6 months old and 4 years old, and there are some 110,000 children who are not vaccinated. Empirical evidence proves that vaccination is effective in preventing serious illnesses or death. But the point is you have to complete the full course of 3 doses. With only 1 dose, the protection is limited. So you have to get vaccinated as soon as possible and get all 3 doses. Like Dr. Zhuang mentioned, for serious or critical cases, maybe the patients did not complete the full course of vaccination yet. So we hope that parents can at least get 1 dose for their children. It will be at least 6 weeks before the first dose become effective. Next question, please. Good afternoon. I'm from Mingpao Daily. The 2-year-old boy who is in critical condition. Yesterday, you said it was a suspected case of acute encephalitis. So, does the MRI or other checks reveal the true condition? Now, today you haven't told us about the number of infections in HA. Can you tell us the new number? Now, for the 李寶春聯合書院, the school, do all the 14 cases live in the same dormitory? And how many students are required to undergo quarantine? And what about the percentage of other subvariants of Omicron? On the 李寶春 school, all the students live in dormitory. There are several cases in each block. So those students in the same room would be classified as close contacts, but not all the students are close contacts. The classes have been suspended for 1 week. On your other question about the percentage of other viral strain of Omicron, so BA.5, it is 77.5%, BA.4, 6.5%, BA.2, 12.1, 3.6, BA.2.2, 13.4%. For our staff, there are 114 new infections and 72 colleagues have returned to their positions. Concerning the 2-year-old boy situation, he is still in critical condition. Our medical team has arranged different checkups for the boy. Next question, please, the gentleman at the back. I'm from AM 730. On the Li Po Chun United World College, the 15 students, how many classes do they come from? For cases in the 4 blocks of dormitory, did they contract the disease in classes? And besides class, would they stay in the dormitory? Now, the percentage of inbound travelers infected is not high. Now, if you allow them to take public transports to go to the community, would it increase the risk significantly? Now, there are 4 clusters in a hospital. So how many people would be dedicated to caring for the patients in the clusters? And what about the previous patient's condition? For the Li Po Chun United World College situation, there are 2 classes. In class 11, there are 3 cases. Class 12, there are 12 cases. There are lots of mixed activities between the 2 classes. And also there are extracurricular activities. Some involve going outside of school, so it may have caused the infection. Concerning the monkeypox patient, the situation is stable and he has been discharged. Now, monkeypox is a transmissible disease, similar in nature to COVID. So we will tackle the situation with a high standard, and there will be sufficient personal protection equipment for clinical staff. So for the cluster, for emerging clusters, we have made arrangements in hospitals to receive patients, including isolation wards and also a treatment plans. We do have a plan. Well, we don't have the statistics concerning the actual number of rooms or manpower available, but we maintain the flexibility. Well, concerning the transport mode of inbound travelers, well, that is related to the SAR government's immigration policy. The government will consider different factors, and announcement will be made in due course. If there are no more questions, this is the end of today's press briefing. Thank you.